CMDDA, a Canadian Medical Dental Development Association,
is a non-profit organization of Canadian physicians,
dentists, pharmacists,
and other allied health professionals. This volunteer organization was founded in 1998. Teams of physicians and dentists have visited Sri Lanka to provide medical and dental assistance
to communities affected by the civil war,
where they lack the most basic medical facilities. Medical teams from CMDDA organization took part in north and east part of Sri Lanka to provide medicines and support for the tsunami relief mission during the period of December 2004 to early 2005. The doctors have all volunteered their time and resources to make this endeavor a success. Funds raised from the past events of Lights of Healing have contributed to the cardiac unit of the Jaffna Teaching Hospital, Tsunami Mission, Alzheimer Day program at Providence Healthcare, Seven Oaks Long-Term Care Homes, Toronto, Canadian Cancer Society, Sick Kids Hospital, Amnesty International. Ontario Trillium Foundation publishes an annual health education magazine named Nalamthana.
Annually, a health forum, which is an educational seminar, is organized as an health awareness to the Sri Lankan community in Canada.
CMDDA organization of healthcare professionals have a vision to provide humanitarian and medical aid whenever and wherever needed. Our core mission is to unite physicians, dentists, and other healthcare professionals with similar interest to work together to provide humanitarian assistance to a population in need, with a focus on the Tamils in Canada and abroad. We propose to achieve this goal by assisting in the training and supervision of medical, dental, and allied healthcare workers in developing countries, especially in Sri Lanka, so that they will be able to serve the population concerned effectively and efficiently.
Distribute drugs and medical supplies to war-torn and grief-stricken areas.
Health sector is one of the worst affected service sectors, and the history of Jaffna Teaching Hospital and the experiences of the staff who remained here all these years would be sufficient enough to portray a clear picture of what has happened in the health sector during this period. Jaffna Teaching Hospital is one of the largest hospitals in the country, which has a bed strength of over 1,000. It was one of the best service providers in the health sector before 1983. Since it had all major specialities and subspecialities available in the country at that time. But the tragedy unfolded following 1983 drastically altered everything. Several medical professionals and professionals from allied medical disciplines left the country seeking secure life. Thus, the services of several units and departments of the hospital were badly curtailed or completely stopped. The pediatric unit was the worst affected, since it lost a consultant pediatrician and a senior medical officer during the Indian military attack on the hospital on October 1987, during which 22 hospital staff and more than 80 patients were killed. The pediatric unit was completely paralyzed following this. A permanent pediatrician assumed duties only in 2003, but the situation was not very much improved, since the pediatricians appointed here were often transferred within a short period. The situation started improving after 2006. Now, there are 3 consultant pediatricians and a team of 14 medical officers and 18 nurses serving here. But even now, the unit struggles hard to cope up with the situation since the population to be catered is huge. The Jaffna Teaching Hospital caters the entire population of nearly 1 million from the northern province, in which nearly 40% are children. The present pediatric unit has 3 wards and each ward has a bed strength of 40. Further, the unit conducts outpatient clinic every day except on Sundays. The following statistics would paint a clear picture of the present scenario. 12,990 regular patients and 1,770 new patients were seen in the outpatient clinics in 2010 alone. 8,833 regular patients and 1,226 new patients were received during the period of January to July 2011. (8,833 regular patients and 1,226 new patients received the services of the outpatient clinic from January to July 2011. Further, the premature baby unit had received 1,309 admissions in 2010 and 563 babies were admitted to the PBU during the period of January to July 2011. The next most affected area in pediatrics is neonatal services. When the world is moving towards the fetal surgery and fetal medicine, Jaffna Hospital struggles to get even the basic facilities. Further, the PBU had received 1,309 admissions in 2010 and 563 babies were admitted to the PBU during the period of January to July 2011. This is nearly 20% of the children delivered at the Jaffna Teaching Hospital and the suburban hospitals who were transferred here, since these hospitals don't have the PBU facility.
The story of Markham Stouffville Hospital is the story of our community. It's about people and about life. It's about generosity and partnership. And it's a story still in progress, because at Markham Stouffville Hospital, we're building.
We're building the future.
We're building
new bones.
We're building families.
We're building bundles of joy.
We're building more space.
In 1990, Markham Stouffville Hospital opened its doors, ready to serve a region expected to grow to approximately 110,000 people. Now we number over 300,000, and the demand for your hospital services has risen dramatically. So, we're building.
Area where the new Donor Recognition Center of the Foundation is located.
Taking you up along the open staircase, which we encourage you to use, you'll come into the new Diagnostic Imaging Center, located directly above our new emergency. I'd like to now take you into a CT scanner room, which is a very large single room to help those that may feel claustrophobic. It's also designed to ensure good visual contact between the patient and the technician, which we know our patients find very reassuring. There's also a faux skylight to contribute to the feeling of airiness during this stressful procedure. This is one of our brand new 8 operating rooms configured to be used as a regular OR, but also to be used for minimally invasive procedures. Here now, you'll be a part of the 4th floor of the new building, which is dedicated entirely to maternal child